Hello everyone, welcome to Med Smashers. Today I am gonna discuss about a very important topic, optic neuritis. So let's start. The definition is inflammation of optic nerve. Ophthalmoscopic appearance or types are papillitis, which is inflammation of optic disc, retrobulbar neuritis, neuroretinitis. Here, optic nerve along with retina is damaged. Together they are called optic neuritis. Causes or etiological classification of optic neuritis. Idiopathic, demyelinating disorders like multiple sclerosis, infection. In infection, there are local and systemic infection. In local, endophthalmitis, and in systemic, the causes are viral, influenza, measles, mumps, infectious mononucleosis virus. In bacterial, tuberculosis, syphilis, and Lyme. Fungal, Cryptococcus protozoal, Toxoplasma parasite, cysticercosis. Immune-mediated, in local, the cause is uveitis, and in systemic, the cause is sarcoidosis. In metabolic diabetes, toxic neuritis. Symptoms of optic neuritis: uniocular sudden painless loss of vision which is progressive. Signs of optic neuritis: visual acuity is decreased, pupil is dilated, sluggish reaction, color vision is decreased. In ophthalmoscope, we can find edema of the optic disc. It is not papilloedema because papilloedema is always bilateral and in huge amount. Disc hemorrhage may be present. Investigations of optic neuritis are color fundus photography, fundus fluorescence angiography, visual field loss. Now the treatment. It must be started as early as possible. Intravenous methylprednisolone 1 gram at drip for 3 days mixed with normal saline. After 3 days, oral prednisolone 1 mg per kg for 1 month and stop gradually by tapering the dose. Capsule omeprazole, vitamin B1, which is vitamin biovit, can be given. I hope you have liked this lecture. If you like it, then give a thumbs up and subscribe to my channel. And I also have an Instagram account. I will put the link in the description box. Thank you everyone. Bye.